স্নায়ু। আমরা জানি আমাদের শরীরের সমস্ত ক্রিয়া প্রতিক্রিয়া সব কিছু নির্ভর করে আছে স্নায়ুর ওপর। স্নায়ু রোগ ইদানিংকালে বেড়েছে বলছে পরিসংখ্যান, কিন্তু স্নায়ু রোগ নিয়ে অকারণ ভয় নয়, দরকার সচেতনতা। আর স্নায়ুর অপারেশনের ক্ষেত্রে কী কী অ্যাডভান্সমেন্ট হয়েছে ইদানিংকালে সেই সব জানাতে আমাদের সঙ্গে আছেন ডক্টর Srinivasan Paramasivam.
Namaste.
He is from Apollo Hospitals, Chennai, and he is the head of Neuroendovascular Surgery Department in Apollo Hospitals, Chennai. আমরা আজকে ওনার সঙ্গে কথা বলবো, জানতে চাইবো এই যে নিউরোসার্জারি, আমরা জানি ভীষণ ভয়ের ব্যাপার আমাদের মনে হয়, কারণ স্নায়ু এত সূক্ষ্ম একটা বিষয়, তার একটু এদিক থেকে ওদিক হলে জীবনে কিন্তু বিপর্যয় নেমে আসতে পারে। তো স্নায়ুর চিকিৎসা বা স্নায়ুর অপারেশন কি সত্যিই এতটা ভয়ের? শুড উই স্কেয়ার অ্যাবাউট নিউরো অপারেশন অর সামথিং লাইক দ্যাট, অর এনি কাইন্ড অফ মেডিকেল অ্যাডভান্সমেন্ট ইজ দেয়ার নাও?
Neurosurgery is a surgery of the brain and spine. In general, people have an apprehension. If I have to undergo surgery for my brain and spine, will I be able to walk and talk, be normal after my surgery? That is a very concerning and important question, but I can assure that neurosurgery in today's world, with the advancements in technology and with the advancements in technique and with an experienced surgeon like us, it is very, very safe and people doesn't have to be afraid about, and neurosurgery can be done very safely, and after surgery we can get you back on track doing your day-to-day routine work in a very safe and an effective manner.
এই ডাক্তারবাবুর এই কথাটা যে কোনো নিউরোসার্জারির পর তারা দায়িত্ব নিয়ে একজন পেশেন্টকে তাদের স্বাভাবিক জীবনে ফিরিয়ে দেবেন, এটা কিন্তু একটা বড় অ্যাসিওরেন্স। আমরা জানি নিউরোসার্জারি মানে বোধহয় অনেকক্ষণ ধরে একটা কেটে কুটে অপারেশন করা, সত্যি কি তাই? আমরা শুনেছি মিনিমালি ইনভেসিভ সার্জারি, এটা একটা মেডিকেল অ্যাডভান্সমেন্ট। হোয়াট ইজ দ্যাট মিনিমালি ইনভেসিভ সার্জারি?
Today every surgery has become minimally invasive. Especially neurosurgery, we have a lot of minimally invasive techniques. Most of our surgeries are micro neurosurgery, wherein we use the microscope to magnify and specifically operate at a location where we want to remove the lesion. One. Second thing is we have endoscopic surgery. Endoscope may be through the nose or maybe through the brain. The endoscopic surgeries are minimally invasive surgeries, and then we also have endovascular surgeries. Endovascular surgery, like you have the stent in the heart, we go through the blood vessels, and with minimally invasive techniques we do procedures in the brain for lesions like brain aneurysms, arteriovenous malformations. We treat them completely endovascular, which means right after surgery patient can stand and walk, the next day patient can be discharged. So with all these advancements in minimally invasive surgery, today neurosurgery has come a long way and it has become very safe and effective procedure.
Okay, so there is no scar and no fear.
Correct. In today's world, when we do endovascular and endoscopic surgeries, absolutely no scar. People may have a tumor like a pituitary tumor, and we operate through the nose, absolutely without scar. The patient can recover in a few days' time. In endovascular surgery, the only cut or a puncture is in the groin, and endovascularly we go and treat. Without any scar, patient can recover. Even otherwise, even if we do microsurgery, for most patients we don't even have to remove the hair. Only at the point where we are making incisions, we minimally remove the hair, and after 2 weeks, if the patient is combing the hair and walking on the street, nobody would find out that the patient even had a brain surgery. So in that way, neurosurgery has evolved a lot.
Okay, then you were talking about the brain surgery, and when you were talking about the brain, another word, stroke. স্ট্রোক কথাটা বোধহয় আমাদের কাছে সকলে ভীষণ টেনশনে, কারণ আমরা জানি স্ট্রোকের মতো জিনিস একটা মানুষের জীবনটাকে তছনছ করে দেয়, শুইয়ে দেয়, পক্ষাঘাতের মতো ঘটনা, প্যারালাইজ হয়ে যায় মানুষ। তো when do you suggest an operation after stroke?
Yeah, stroke in general, it's an umbrella term, which means there are two types of stroke. One, blood vessel to the brain is blocked, where it's called ischemic stroke. The other type of stroke is where a bleeding happens in the brain. That's called a hemorrhagic stroke. if there is a hemorrhagic stroke due to aneurysm rupture, we can go endovascularly, coil the aneurysm and treat it. If the bleeding is inside the brain, sometimes we do a microsurgery to remove the clot, and both these procedures have to be done emergently. On the other hand, ischemic stroke, when there is a block in the blood vessel and it blocks a major blood vessel, we go endovascularly, remove the clot and open the blood vessel to the brain. That is, again, has to be done as an emergency. Sometimes people have a block in the neck, the carotid blocks, that can be treated more electively, and we do both endovascularly, the stenting, or we do a endarterectomy. Both these procedures are very minimally invasive procedures wherein the patient recovers the next day, and by third day patient can be brought back to normal. So stroke is a very, very important disease. If not treated on time and emergently, they may end up with weakness and inability to walk, with paralysis for life.
Lifelong.
Yes, correct. So if you treat emergently and do the right treatment in the acute situation, they can recover completely.
ওকে, একজন স্ট্রোক পেশেন্ট প্রথমত যেটা মানুষের ভুল হয়ে যায়, টু আইডেন্টিফাই দ্য স্ট্রোক, হোয়াট আর দ্য অ্যাকচুয়াল সিমটমস, যেটা লোকজন দেখবে, দেখে চিনবে যে না পেশেন্টের স্ট্রোক হয়ে থাকতে পারে। হোয়াট ইজ দ্য গোল্ডেন আওয়ার দ্যাট পিপল শুড রাশ টু দ্য হসপিটাল টু গেট আ বেটার ট্রিটমেন্ট?
That is a very good question. To identify somebody having stroke, you have to understand the term be fast. B stands for balance. If somebody is standing and not able to balance, that is B. If somebody has a vision loss, especially in one eye vision loss, sudden visual loss, that is a sign of stroke. F stands for face. If anybody's face is drooping, you ask them to smile. If face is drooping, that's a sign of stroke. A for arm. Ask them to lift both the hands. If the arm is drifting or not able to lift the arm, that is a sign of stroke. S stands for speech. If they are not able to speak properly, you ask them, they are not able to understand or speak, that is a sign of stroke. If anybody in your family or in your neighborhood has any of the signs of be fast, and T stands for time, if they have any of these signs, it's time to act. Call the ambulance, get them to the nearby hospital. Extremely important, you should know be fast.
Means as soon as possible, hospitalization is important.
Yeah, you asked about the golden hour. Yes, anybody who has a stroke, there is no time limit. As soon as possible is the best time, but in general, if somebody comes within 4.5 hours to the hospital, we treat them with what is called thrombolysis. We give them a clot busting medicines and open up the clot. That is the first timeline you should remember. The second timeline is if they come within 24 hours, we also treat them with endovascular thrombectomy. That is, we go inside the blood vessel, remove the clot and open the blood vessel. So you have to know the time. 4.5 hours, 24 hours are the golden hours for stroke, and earlier you come, the better the clinical outcome would be.
Okay, actually brain manages the whole body. So brain stroke যদি কারোর হয়ে যায়, কেউ ধরুন স্পিচ লস করলো, is there any problem with speech or balance? Can they get back to the normal life after the operation, or it depends on?
Yeah, any effect on the brain is represented as symptoms. The brain has different areas. Some area controls the hand movement, some area controls the speech, some area controls the vision. If that particular area is affected, then patient develops symptoms. But we need to identify what causes these symptoms. So in general, immediately after somebody develops a symptom, we do an MRI brain. MRI will show whether it is stroke or whether it is bleeding or whether it is a tumor which is causing the compression. And if we identify the tumor with the MRI and treat it appropriately in a quick time, there is a good chance they may recover to a normal functional level.
Okay. And another problem we want to ask you about is brain tumor. ব্রেন টিউমার ভাবলেই অবশ্যই একটা ভীষণ ভয়ের বিষয়, এবং ব্রেন টিউমার আর যদি সেটার আবার ম্যালিগন্যান্সি থাকে তাহলে ব্রেন ক্যান্সার। তো when you suggest for a surgery?
Yeah, brain tumor is a broad term. There are more than 150 types of brain and spine tumors. Luckily, good number of these tumors are benign tumors. when they grow very slowly, compressing the brain, and we identify with MRI and with advanced technology like we have in Apollo Hospital, with advanced technology using MRI scan to identify the tumor, do MR spectroscopy, MR tractography, all this for imaging. Then subsequently during surgery, we do a microsurgery. Microsurgery, we do it with the fluorescent guidance, we do with navigation guidance. Navigation is a technology where like you go in a car, there is a GPS guiding you. Likewise, during brain surgery, we have the navigation guidance. And during surgery with intraoperative neuro monitoring, that is continuously the nerves are being monitored while the surgeon is operating with the intraoperative neuro monitoring guidance. If we do the surgery very safely and precisely, there is a very good chance the patient can be cured of the disease and the patient can recover and do a normal functional life after surgery.
Okay, so this is the point যে এই যে একজন সার্জারি হলো, এই সার্জারি হওয়ার পরে লোকে ভাবে যে আমরা কতটা সুস্থ থাকতে পারবো, বা পেশেন্টের বাড়ির লোকের যেটা চিন্তা হয় একটা নার্ভের সার্জারি, তারপর কি সে আবার একদম যেভাবে কাজ করতো সেইভাবে কি কাজ করতে পারবে একদম আগের মতো শক্তি নিয়ে, কিংবা একজন পেশেন্ট যাকে হসপিটাল থেকে বাড়ি নিয়ে যাব, হোয়াট উইল বি দ্য পোস্ট অপারেটিভ কেয়ার? I learned so that Apollo Hospital Chennai has a very good and very unique post-operative care unit. So what is that?
Yeah, any patient undergoing surgery is just one part of the treatment. After surgery, patient is usually monitored in the neuro-intensive care unit, and after neuro-intensive care, the patient is moved to the regular ward where the patient is being mobilized along with the family. The patient is being treated to get back to normal society. This is the immediate post-procedure period. Even after the patient returns back, for example, somebody coming from Kolkata getting treatment in Chennai, even after they come back, on a weekly basis, we keep track of the patient and monitor the patient. We have the online consultation where the patient sitting at home, they are able to consult us. We also have Apollo information centers in Calcutta where they can visit, and through telemedicine they can consult us, and after 3 months usually we review the patient. Even for reviewing, we do visit Calcutta regularly on every 3 months basis so that we see all our post-operative patients and guide them and help them to get back normal to the society.
ভেরি নাইস। অ্যাকচুয়ালি পেশেন্টের বাড়ির লোকেরা এটা শুনে খুব আশ্বস্ত হবেন। অনেকেই ভাবেন এই যে চেন্নাইতে গিয়ে অপারেশনটা করাবো, তারপর কিভাবে আমি ডাক্তার দেখাবো, ডাক্তারবাবুর কাছে পৌঁছতে কি আবার সেই চেন্নাই দৌড়তে হবে? এই কথাটাতে হয়তো অনেকেই আশ্বস্ত হবেন। যারা অ্যাপোলো হসপিটালস চেন্নাইতে গিয়ে দেখাবেন, অপারেশন করাবেন, তারা কলকাতাতেও ডাক্তারবাবুদের দেখা পেতে পারেন, তাদের থেকে পুরোপুরি কনসালটেশন নিতে পারেন, ইভেন অনলাইনেও তাদের সঙ্গে যোগাযোগ রাখা যায়, যেটা একটা ভীষণ ভালো পয়েন্ট। এবারে আসি পার্সোনালাইজড কেয়ারে। উই অল নো দ্যাট এভরি পেশেন্ট ইজ ইউনিক, দেয়ার বডি ইজ ইউনিক, দেয়ার প্রবলেম ইজ নট এক্সাক্ট সেম টু ইচ আদার, অলমোস্ট ইউনিক। সো what do you do when you address a new patient, when you go for a surgery for a new patient? What the advanced medical technologies there are in Chennai Apollo to address personalized care?
The most important in a patient's care is understanding the patient's symptoms, understanding what he is suffering from in relevance to what we see in the scan. And our goal is treating the patient and putting him back to the normal social life he is leading. So we make more detailed assessment of the patient, that is the primary. Then comes the technical skill of surgery where we do very meticulous surgery. Then comes the technology to help us. Technology in a sense, as I previously told you, there are various technologies we use during surgery, that is microscope, intraoperative imaging, then intraoperative neuromonitoring, navigation guided surgery, if needed endoscopic or endovascular surgery, all put together. These kind of technology we use to minimize the amount of trauma that the patient is going through, and we look at in which way the patient can have quick and faster recovery after surgery so that he can get back to his home country or home city and then do his normal routine activities in a very quick time.
What is actually the personalized 3D model of patient's anatomy you work on? What is that?
Yeah, there are various ways we analyze a patient. There are certain situations, not every patient needs a 3D analysis, but some patients would need a three-dimensional view of the tumor, the imaging in relevance to the normal brain structure. For example, if we are operating on a skull tumor and we are removing the whole tumor and replacing it with the artificial bone, in that case we do a 3D modeling before. We mark the area that needs to be resected. We also prepare the cranioplasty in such a way that we are able to replace in a very quick time along with the primary surgery, so that in one shot the patient can be cured. So 3D technology does help us in treating certain part of the brain lesions, and we use it very effectively at Apollo Hospitals, Chennai.
Nowadays, robotic surgery is a very commonly used term. Do you use robotic surgery in brain surgery also?
In general, for brain surgery, so far, no dedicated robo has been developed. But what we do is a navigation guidance. The navigation guidance in both brain and spine, we use navigation, which is the evolution, the first step in robotic surgery. Hopefully in future, in maybe 5 to 10 years from now, we'll also be doing actual robotic surgery in brain.
When you do surgery for spine, what are the medical advanced technology do Apollo Hospital use?
Spine surgery has evolved a lot. Spine surgery means operating somewhere from the CV junction, cervical region, dorsal region to lumbar region. We do the spine surgery. For spine surgery, we use minimally invasive endoscopic spine surgery. We also do microspine surgery, and then we also use intraoperative during procedure imaging, that is both with the C-arm as well as O-arm. O-arm is a CT scan done during surgery, and navigation guided spine surgery as well. With the navigation guided spine surgery, the amount of radiation exposure, when we use X-rays, there is radiation exposure. But with the use of O-arm and navigation guidance, the amount of radiation exposure minimizes and it is more accurate and precise.
So, a few years back, আমরা এটাই জানতাম যে একটা বড় নার্ভের অপারেশন করাতে গেলে বা একটা নার্ভের ট্রিটমেন্ট করাতে গেলে আমাদের অ্যাব্রডে যেতে হবে। অনেকে সেই ক্ষমতা থাকতো, আবার অনেকে থাকতো না। তারা ভাবতেন যে দেশের মধ্যে কিছু কি হয় না। তো যতদূর শুনেছি অ্যাপোলো হসপিটালস চেন্নাই ভারতবাসীর জন্য এরকমই কিছু নিয়ে এসছে, যেটা অ্যাব্রডে ট্রিটমেন্টটা যা যা আমরা ফ্যাসিলিটি পেতাম সেটা এখন ইন্ডিয়াতেই করা যাবে। ইজ দ্যাট সো?
Correct. In today's world, absolutely there is no need to travel abroad to get advanced treatment. I mean, I myself have worked in the United States for 7 to 8 years. Before returning back to India, I can vouch and tell you all the technology and facilities are available in India, especially at Apollo Chennai. We have the most advanced technology, and there is absolutely no need to travel abroad to get the same kind of a treatment. And with this available technology and expertise, whatever you get at an international hospital, you will be able to get it locally. So that's the whole idea of development of this advanced technology at Apollo Hospitals Chennai.
And it is very much cost friendly also, pocket friendly also than the abroad.
Absolutely. And I can tell you, in terms of cost range, it is maybe 1 in 50th or 1 in 100 if you compare the United States. If you compare Europe, it's 1/10 of the cost. So absolutely it's cost effective and more effective treatment as well.
থ্যাংক ইউ স্যার। আমরা অলমোস্ট ইন্টারভিউয়ে লাস্ট ল্যাপে, এবং আমরা ডাক্তারবাবুকে অসংখ্য ধন্যবাদ জানাতে চাইব। থ্যাংক ইউ সো মাচ। আমাদের সঙ্গে খুব ইম্পর্ট্যান্ট কিছু ইনফরমেশন ভাগ করে নিয়েছেন, যা থেকে বহু মানুষ উপকৃত হবেন। বিশেষত কলকাতায় বসে যারা ভাবছেন যে চেন্নাইতে গিয়ে দেখাবো কিনা বা গেলে কোনো অসুবিধে হবে না, তো তাদের হয়তো অনেক উত্তরই তারা আজকে ঘরে বসে পেয়ে গিয়েছেন। থ্যাংক ইউ সো মাচ ডাক্তারবাবু। আপনার দিন ভালো কাটুক এবং আপনার পরামর্শে বাকিরাও সুস্থ থাকুন, ভালো থাকুন।
থ্যাংক ইউ।
এবিপি আনন্দ, এগিয়ে থাকে, এগিয়ে রাখে।